Now we are in the middle of a COVID surge in South Texas.
As KENS 5's Jeremy Baker reports in tonight's Verify, the testing numbers may not reflect the surge.
As soon as COVID tests were available, whenever most people had a sniffle, cough, or any illness, they'd rush to get tested. But years later, that just isn't the case. But there are other ways to figure out COVID levels are on the way up or on the way down. That leads us to tonight's claim. Is it true that wastewater can be used to track levels of COVID? Our sources for this Verify are Dr. Jason Bowling, an infectious disease specialist with University Health, and Dr. Barbara Taylor, a professor of infectious diseases with UT Health San Antonio. Dr. Bowling told us the technology has been around for years, but is now being used to track COVID too.
Basically what they check is as the water enters the wastewater plant, they take small amounts, they test it for the RNA of the virus. And so that allows you to test for people that don't have any symptoms and people that are sick and confirm it because it's just getting all the wastewater.
Dr. Taylor says wastewater testing is needed since so few people are now getting tested and reporting positive cases.
It is interesting to see how important wastewater monitoring has become because it is really one of the more reliable indicators, and it can be an early indicator of when a community is going to see more cases of COVID.
So yes, it is true. Wastewater can be used to track levels of COVID. The CDC has this wastewater metric map so you can track whether COVID levels are going up or down based on wastewater findings. We'll have the link with this story on KENS5.com. For the Verify team, Jeremy Baker, KENS 5.